Good morning from Nisanan Miwok lands, also known as Sacramento. My name is Joyce Royce Aguilera, Implementation Strategist here at the California Endowment. I'm excited to welcome you all and to be your moderator for our first Policy Perspectives webinar of the year, a look at California's 2026 policy and budget landscape. I have a few housekeeping items before we get started today. First, as a reminder, this webinar is being recorded, and the recording and any slides presented today will be shared with all registrants after the event. Second, we encourage you all to engage in today's conversations and submit any questions you may have in the Q&A box at the bottom of your screen. We'll do our best to answer as many of them during the audience Q&A portion of the program. We also want to thank those of you that took the time out to submit your questions in advance. Those really shaped today's program. Policy Perspectives is a virtual space for conversations on state and federal policy issues that impact our state and communities. These webinars are nonpartisan and non-political, and they are intended for informational purposes. The policies and actions coming out of DC and Sacramento impact all of us, our communities, and our state. Our state, as you know, has been grappling with budget deficits for a few years, while at the same time, federal budget cuts to safety net programs will have a significant impact on the state-level debates around how best to protect our communities and sustain the safety net. During today's webinar, our speakers will provide an overview of the proposed state budget and share insights about implications of the safety net and communities across the state. I'm now thrilled to introduce our speakers and partners who will help us make sense of the 2026 budget and the current policy landscape. I will not go into their full bios, but you will be receiving these in the post-webinar resources. First, we are excited to have with us Kayla Kitson, Senior Policy Fellow at the California Budget and Policy Center. Kayla will provide an overview and highlights of some key areas of the governor's proposed budget. Thank you, Kayla. You'll hear more from her. She will be followed by Masi Fauladi, Executive Director of the California Immigrant Policy Center. Masi will provide insights on how the proposed budget will impact immigrant communities. Welcome, Masi. And last, but certainly not least, Laura Scheckler, Director of Budget Advocacy and Strategic Policy at the California Primary Care Association, or CPCA. Laura will provide insights into the implications of the safety net and the communities served by community health care centers. Welcome, Laura. I'll now walk you through the flow of today's program. Kayla will provide an overview of the governor's budget. Then we'll hear opening remarks from Masi and Laura. After all those remarks, I'll invite everybody back for a panel discussion. After the panel section, we will have time for audience Q&As again. So I remind you to enter any of those questions in the Q&A chat, and our panelists will also be answering those as they come through as well. Okay, let's get our program started. Kayla, I'll turn it over to you.
Thanks so much, Joyce. Happy to be here with you all today. Again, I'm Kayla Kitson. My main focus at the Budget Center is on tax and revenue policy. So I'm going to try to do justice to the areas that are covered by all my other wonderful colleagues at the Budget Center. So today, if we go into the next slide, I'll just give a little preview of what I'll talk about. And my cat is looking like he might jump on me at any second, so hopefully he'll leave me alone. So I'll go over the governor's main approach to the budget and then talk about some key elements of the plan in the areas of health, economic security, housing, and education. And then we'll talk a little bit about what's next if we have time. So on the next couple slides, we just always like to ground these types of discussions in why budgets matter. And budgets are really a reflection of values and priorities. Sorry, we can go to the next slide. And so our main takeaway from of the governor's proposed 26-27 budget is that it really fails to meet the moment that we're facing right now. The budget generally maintains existing state services, but as we'll see soon, the plan targets immigrants for additional cuts, while at the same time protecting billions of dollars in costly tax breaks for profitable corporations, even as we're seeing millions of Californians struggling and will be hit hard by the budget cuts, the federal budget cuts from HR 1. So moving on to the bigger picture, we can move on to the next slide. The plan assumes that state tax revenues will continue to see strong growth, and that'll result in a roughly balanced budget with a small manageable deficit. The proposal is also expecting that the state will end the next fiscal year with over $20 billion in total state budget reserves. Now, it's worth noting, because people might have seen this in the media, that the state's Legislative Analyst's Office, or LAO, had different projections, lower revenue growth and a larger deficit relative to what the governor's administration has projected. And just the key driver of that difference is that the LAO incorporates a stronger risk of a stock market downturn, which could lead to less optimistic revenue forecast. And that just reflects their concern that the current strength in the stock market, which is really buoying state revenues, might reflect a kind of AI bubble that could pop as investors are excited about AI, and that might not be sustainable. But it's also just important to note that neither the administration or the LAO has a crystal ball telling them what revenues are going to look like in the future. So it's really not that unusual for them to have different projections based on different assumptions. Moving on to the next slide, another key thing to note is that the governor's proposal doesn't include any plans to raise significant new revenues that could help protect Californians from the harms that we'll be seeing from the federal cuts to healthcare and food assistance made by HR 1. On the next slide, we'll just note that in order to protect Californians from those cuts and protect and strengthen existing state services, California would need to raise significant new revenues. And one commonplace sense for the legislature to start would be to eliminate corporate tax loopholes and make sure that large profitable corporations are paying their fair share in taxes. But we don't see any types of proposals like this from the governor in this budget, which we see as a major missed opportunity. Now, I'll move on to some of the specific areas of the budget and what we're seeing, starting with health. We can move on to the next slide. So last year, I'm sure folks remember that we saw the state enact policies that restricted immigrants' access to healthcare, including the freeze on new Medi-Cal enrollment for undocumented Californians and monthly premiums on some immigrants that are already enrolled. So the governor's 26-27 budget goes further and includes additional policies that would harm immigrants' access to care. The first proposal would be to apply work requirements to undocumented Californians that are enrolled in Medi-Cal. And while HR 1 imposes those work requirements on the Affordable Care Act expansion population, there's no requirement to impose those burdensome work requirements on undocumented Californians who are receiving Medi-Cal under an entirely state-funded program. And second, the budget also fails to extend state-funded full-scope Medi-Cal coverage to immigrant populations that are stand to lose coverage under HR 1. And those populations include refugees and asylees. And I'm sure Masi might get into more of that later. Moving on to the next slide, continuing in the topic of health, the proposal doesn't address the coming Medi-Cal funding cliff due to the new federal restrictions on the state's managed care organization, or MCO tax. So this is a tax on health plans that's a key source of funding for Medi-Cal, as the additional dollars that it allows California to draw down from the federal government can be used to boost Medi-Cal provider payments as well as to cover existing Medi-Cal costs. So it's all very complicated, but HR 1 imposed new restrictions on provider taxes that will result in billions of dollars in lost Medi-Cal funds. And in the short term, policymakers do have some options to restructure the tax to comply with those new restrictions, but it is challenging because they would have to address some state-level restrictions on the tax that voters approved via Prop 35 in 2024. So just noting, the governor doesn't propose any changes to the tax currently, and assumes that the current tax will be in place through the end of the year, while we've seen some federal guidance suggesting that change could come as soon as July, which would result in a bigger budget impact. And then finally, in the health and behavioral health space, I'll note a few other proposals. The governor does include $60 million in one-time funding for grants to reproductive health care providers who are facing funding shortages due to federal funding cuts. There's also a proposal to use some of the MCO tax revenue for mobile crisis response and other behavioral health investments, and proposes to make mobile crisis response an optional Medi-Cal benefit starting in April 2027, which is when enhanced federal funding for that will expire. Apologies, I'm going through everything very quick. There's a lot to cover, and we can dive into it more later. So moving on to economic security, there's really not a lot to report here. The governor's budget really takes a what they call a workload budget approach without proposing much in the way of new services. So in the area of CalFresh, we saw HR1 make the largest cuts to food assistance in history, but the proposal from the governor doesn't include plans to address this looming increase in food insecurity. It does account for the required increase in the state's share of administrative costs for CalFresh, but we don't see any proposals to increase resources to support either the humanitarian immigrants who will lose food assistance or Californians that could lose food assistance under the harsh new time limits under HR1. And then on the next slide, in other areas of economic security, there's, again, not much to report. Current programs are largely maintained, but there are no proposed augmentations in areas like the state's refundable tax credits, including the state's earned income tax credit or the young child tax credit. Same thing with CalWORKs financial assistance for families and SSI, SSP assistance for older adults and people with disabilities. We also see that there's a walking back of the state's commitment to increase subsidized childcare spaces. Over the past few years, there was a plan to increase the number of spaces, and there was progress made, and then the expansion was paused, and now we see a withdrawn commitment to create another 44,000 slots that were planned for the upcoming year. I'll go quickly through what we're seeing in housing homelessness, which is a whole lot of nothing. There's really no proposed increases in affordable housing funding, even though we're seeing existing affordable housing programs being oversubscribed. And then on the next slide, in homelessness, the budget does maintain a previous commitment for $500 million in one-time funds for the Homeless Housing Assistance and Prevention Grant Program. But this is effectively a 50% cut from the $1 billion funding level that we see in prior years. And we also see the budget allowing for the sunset of some programs addressing homelessness among very specific vulnerable populations. And finally, I'll talk about the approach in education. So on the next slide, you'll see that because of the increase in revenue estimates for the state, that automatically increases the Prop 98 minimum funding guarantee for K through 14 education. So specifically, they're now estimating the guarantee to be $20 billion higher across the 3-year budget window. That includes the last fiscal year, the current, and the upcoming fiscal year. So that $20 billion is relative to the estimate that was made when the budget was enacted last June. And then in the specific areas that we're seeing in education, we do see full funding for the complete rollout of transitional kindergarten, as well as the state preschool program. And the state preschool program allows temporarily the enrollment of 2-year-old children through July of 2027. And then the K-12 space is really the only area that we're seeing some significant investments. So the budget would provide a one-time $2.8 billion discretionary block grant to local education agencies. And that could be used for various purposes, including addressing attendance and enrollment declines, professional development and teacher recruitment and retention, as well as expanding career pathways for high school students. I see I'm 1 minute, so I'm going to finish this up quickly and then hand it back to Joyce. We do see a $2 billion allocation just for cost of living increases for the local control funding formula and other categorical programs. And there's an ongoing $1 billion in funding for the community school model at high needs schools. So with that, I think I have one more slide about the timeline for the budget process, but I think we'll get to that in the discussion. So I'll go ahead and pass it back to Joyce, and looking forward to having a discussion.
Thank you, Kayla. And as a reminder, everybody will be receiving this slide deck after the presentation. And now I'm going to hand it over to Masi from the California Immigrant Policy Center.
Thank you, Joyce. I want to build off on a comment that Kayla made in terms of budgets being a reflection of our values. And one of the things that I think it's important to consider as we talk about the numbers and the budget and the advocacy is the real impact that communities are seeing on the ground. When we talk to immigrant communities over the last year, the two priorities that they mention have been safety from the racial profiling, the kidnapping, and the attacks that they are seeing on the streets. What we're seeing currently in Minnesota, what we saw earlier last year in Los Angeles, communities are just in fear, whether they're going to school, at work, in the privacy of their own homes, because of the color of the skin, because of the language that they speak, they just don't feel safe. And then second, as they are being physically assaulted, seeing the rollback of access to healthcare. Access to Medi-Cal in California has been a huge priority for the immigrant community over the last decade. And so when we talk to immigrant communities, those are the two things that they continue to highlight for us, their safety and their healthcare. And last year, despite all of the attacks that we saw on immigrant communities, we really saw a huge rollback to access to healthcare for our immigrant populations, particularly the undocumented population. In 2026, starting in January, we saw the rollout of a freeze for enrollment for undocumented individuals. Later this year, we're going to see the rollback of full-scope Medi-Cal for undocumented individuals. And then next year, we would see a $30 premium go into place for individuals who are on Medi-Cal. And as Kayla referenced, it only got worse, unfortunately, with the 2026 budget. Now, populations that have had access to full-scope Medi-Cal since the 90s, refugees, asylees, trafficking survivors, and certain parolees will lose eligibility for a federally funded full-scope Medi-Cal. And the governor's budget does not provide full scope Medi-Cal for them. It proposes putting them on emergency scope Medi-Cal. So they would no longer be able to see a primary care doctor, and they would have to go to the emergency room for any of their needs. And to see that kind of rollback of not only Medi-Cal for undocumented individuals last year being again reflected in this year's budget, and now this impact to refugees, asylees, trafficking survivors, has been devastating to the immigrant community. In the budget, we did see a $75 million investment in legal services. There's consistently been that $75 million investment for One California Legal Services. Last year, we saw an increase in those funds by about 27.5 million. And we were thankful for that, but I think contextualizing it with $170 billion in funding that the Department of Homeland Security is getting to continue these attacks on our communities through ICE, through Customs and Border Patrol, and other federal agencies. There just isn't that reflection this year in making sure that we are doing everything we can to have our communities have a lawyer, know their rights, and push back against this unjust detention and the lack of due process they're facing. Two other things that I would want to mention is we did see that the California Food Assistance Program and its rollout for undocumented individuals 55 and over in 2027 was untouched in the January budget. We are glad to see that, but unfortunately, we know that those same refugee, asylee, trafficking survivors who are losing access to full-scale Medi-Cal, in April, they're going to be losing access to CalFresh as well. So now we have another population of immigrant communities that won't be able to put food on the table for their families, and that's something that needs to be addressed moving forward. Lastly, when it comes to economic mobility, we saw funding in last year's budget for the Social Entrepreneurs for Economic Development Program, or SEED. It's a program that allows business owners to be able to get additional training, get some seed funding, and really be able to grow their economic mobility, but also have an impact on their local communities. There was a $7.5 million investment last year. We don't see any investment in this year's budget. So, in this time where communities are under attack, we aren't seeing the type of investment that immigrant communities will need to be able to take care of themselves, take care of their families, as unfortunately they are seeing their primary breadwinners being kidnapped, detained, and oftentimes are really trying to figure out how to survive and provide those basic needs. And so revenue generation is going to be a huge priority for us. We're going to talk a little bit more about that later on. Additional funding for legal services for immigrant communities so that they can have access to attorneys, as well as addressing some of the privacy concerns we've saw in the past year. Information, whether it's regarding healthcare, food access, ITINs, all of that being used in the enforcement arm of the federal government. And so immigrant communities want to make sure that they are safe at home and safe in California. And with that, I'll turn it back over to Joyce.
Thank you, Masi. And now I'm going to hand it over to Laura from CPCA.
Thank you, Joyce, and thank you, Kayla and Masi, for doing that overview and talking about the most concerning impacts for immigrant communities specifically. So I've been asked to share a bit about how these massive policy changes are going to impact the safety net. And because it's within my purview, I'm specifically going to talk about community health centers, although we know that similar trends will also happen throughout other parts of the safety net, such as to counties and public hospitals, et cetera. Just really quickly, if folks are not familiar with community health centers, they are healthcare providers and clinics that are deeply rooted in the communities that they serve. And they offer a wide range of primary care and preventative medical and non-medical services to meet the specific needs of the communities they serve. Most of them are federally designated healthcare entities that by both mission and federal requirements must serve everyone regardless of their ability to pay or their insurance status. So here in California, our members operate over 2,200 clinical sites and serve more than 6 million Californians, and more than 2/3 of those patients are enrolled in Medi-Cal, and 39% of our patients have limited English proficiency. So any change of this scale to our Medi-Cal program has direct and very significant implications for community health centers. So to understand the scale of those impacts, the state is anticipating that in the next fiscal year, about 800,000 Medi-Cal patients will lose coverage due to the HR 1 and current year budget year policies. And then that will grow to about 2 million patients, 2 million Medi-Cal enrollees losing coverage by the 2029 fiscal year. And that's due to work requirements and more frequent redeterminations. And again, those state budget policies, particularly impacting immigrant communities. So in the governor's budget, many of these policies are framed as financial savings to the state. However, we know that when folks lose coverage, it doesn't diminish their need for care. And outside of emergency rooms, community health centers are where individuals can continue to access those services, and usually as self-pay patients, which most health centers have a sliding scale that goes down to 0. So while health centers will continue providing care, they will lose payment for these services for folks who fall out of coverage. So what that means is we are about to experience a massive cascade of cost shifting in the coming years, from the federal government onto the state, and then California is choosing to shift those costs further onto safety net providers and low-income Californians. For health centers, we're still figuring out the exact financial impact, but we estimate that that will be a budget cut of about at least $1.6 billion in the coming budget year, and that's only going to grow exponentially in future years. This is going to be particularly impactful for community health centers located in and serving immigrant-rich communities, but in reality, it's going to impact every health center across the state. And there's just no way to absorb that scale of budget cuts without impacting services. So less funding inevitably means cuts to staffing, services, hours of operation, or potentially the closing of clinical sites. And ultimately, all of those impacts flow down to the patients and limits their access to critical care and services. So with those things in mind, I just wanted to make a few quick points about the governor's proposed budget and this year's budget process. One, as I've been talking about, the January budget is ultimately an exercise in cost shifting rather than cost savings. And it absolutely fails to mitigate the harms from HR 1 and our current year state budget policies, as we heard from Kayla and Messi. Ultimately, the budget passes on the costs of reduced federal and state funding to safety net providers and the communities that they serve. Number two, the governor is essentially kicking the can down the road with this budget and leaving it to the legislature to really coalesce around how they want to deal with our Medi-Cal program. The upside to that is that we're not dealing with a bunch of new budget cuts, although there are some new harms in there to immigrant communities that absolutely need to be addressed. But it also provides an opening for advocates to really work with the legislature in the coming months to shape the solutions that they come up with, because we know that doing nothing is not a reasonable option in this moment. And then lastly, I just wanted to situate this budget in the broader landscape of the really broad and persistent nature of today's federal attacks on healthcare. And we know this is happening in other sectors like education as well. But in healthcare, while there's absolutely these huge impacts from things like HR 1, it also includes really ongoing and escalating attempts to restrict access to care for specific populations and services through executive orders, changes to federal grant funding policies, direct attacks on providers who serve those targeted communities, and then through federal rules and regulatory processes as well. So right now, we're seeing these attacks most aggressively target immigrant communities, as we've talked about, but also the LGBTQ plus community, and specifically transgender individuals, and even more specifically, access to gender-affirming care for trans and non-binary youth. And then there's the ever-perennial attacks on abortion and reproductive health care that we did not even get to talk about today. So I think the big questions that really come up for me when looking at this budget are, one, can California laws and protections that we have in place for specific communities and essential services and providers, can they actually withstand the federal pressures that we're seeing today? That's really a test that's happening right now. And then number two, is our budget actually going to reflect the values of equity and inclusion that California has long sought to include in our state laws and through our agencies and programs and the advancements we've made through past budgets? Or are we going to continue the path of dismantling them that was really started in last year's budget? So with that, Joyce, I'm going to pass it back to you.
Thank you, Laura. I'm now going to invite all of our panelists back on screen for some follow-up questions and conversations, some of which was informed by the questions that we received ahead of time. And the ones that we're currently receiving in the Q&A, we'll share during our Q&A portion of our time together. So maybe let's start with a question to everybody and start off with Kayla first. What, if any, financing mechanisms are being considered to address California's budget shortfall? Are there any policy opportunities for revenue generating solutions on the horizon?
Yeah, I can start with that. Great question. Thanks so much for asking. Like we've talked about previously, revenues are going to be a key piece of not just addressing whatever budget shortfall comes up, but also doing what we can to mitigate the harms of HR1. At this point, I don't have much to share about what legislators are thinking. Again, we didn't see any proposals from the governor, but we're hoping that there might be some discussion on the horizon. We know there are a number of legislators that are interested in looking at revenue solutions as opposed to making cuts that are going to harm vulnerable populations. There are some opportunities that we've been talking about a lot that have been getting some attention. One of them is closing a big corporate tax loophole that basically allows big businesses that operate multinationally to stash their domestic profits abroad in tax havens, and then basically that those profits are shielded from state taxes, and that's something that costs the state potentially $3 to $4 billion a year. So that's something, it's relative to the impacts of HR1. It's small, but those are some of the kind of low hanging fruit that we think legislators, policymakers could start by looking at. Also doing something to make sure that the most profitable corporations aren't basically paying nothing each year, because some of them are able to use tax credits to basically wipe out their tax bill and then pay next to nothing. So in the past, policymakers have temporarily restricted those types of credits and deductions just to address budget deficits, but we would suggest that there's more to be done on an ongoing basis to make sure that the large corporations are paying their fair share and propping up state revenues.
Thanks, Kayla. Masi, would you care to comment on this from your perspective as well for immigrant communities?
Yes, yeah. I think one of the things I would want to highlight, so many of the reasons for the impact on immigrant communities, whether it's health, care, food access, is a result of HR1. And what HR1 did at the federal level is give massive tax breaks to billionaires and corporations. And at that, as we're seeing those massive cuts, we're also seeing over $170 billion go into the Department of Homeland Security to really terrorize our communities on the street. And so, as we were having conversations with the legislature, having that corporate accountability and making sure that billionaires pay their fair share were really top of mind. One proposal that has come to the top and is being proposed by lawmakers is taxing the private detention centers in California that are getting contracts in the hundreds of millions of dollars from the Department of Homeland Security, taxing them at a rate of close to 50%, and reinvesting that funding into programs that support immigrant communities, whether that's legal services or other programs to make sure that immigrant communities in California are safe. Similarly, there's another proposal around taxing corporations that contract with the Department of Homeland Security. And so that really is where we're talking about and thinking about accountability. And I think the last piece around the healthcare funding and support, there's been conversations going back to last year around some of these big box stores like Walmart and others who underpay their staff. And then as a result, those individuals are on Medi-Cal. And then that means essentially that the state is subsidizing, providing healthcare to employees at these corporations that are making billions of dollars. And that just does not sit right with us when they are making profits and then forcing their employees who they are underpaying to be on Medi-Cal. So at least those are some of the conversations that we've seen in the legislature that would go a long way in making up for some of these gaps and at least having that accountability.
Thanks, Masi. Laura, do you care to comment from your perspective on the health safety net?
Joyce, I think I've lost track of the original question at this point. I'm sorry. Will you restate it again?
Absolutely. Yeah, thank you for that. So the question was, given all of the cuts, what, if any, are some financing mechanisms that are being considered right now? Or what other policy opportunities for generating revenue do you see kind of in the horizon from your perspective for protecting the health safety net and all the vulnerable communities that you've started to highlight that will be impacted?
Yeah, thank you for that. And I will say, I think that I will mostly pass that off to Kayla and Masi's response here. CPCA is absolutely interested in that conversation and absolutely believe that the state needs to identify revenue generating solutions to backfill these cuts. But we are at this point mostly kind of looking to our partners who have really been leading in that space and developing different opportunities and different ideas about how the state can move in that direction.
Great. I think that's a great segue to my next question around for everybody here, and we can take it in order as well. What opportunities do you see for collaboration and coalition building across different issues and sectors in this current context and landscape? Why don't we start with Kayla and then go around again?
Sure. I might sound a bit like a broken record here, but since my focus is tax and revenue, that's where my brain is going. There's a lot of unity on the anti-tax side of things, right? And legislators are hearing a lot from business groups and anti-tax groups, but we don't. I think things are starting to change as we see all these horrible threats coming down. But one area I think for unity is that no matter what issue area you're working in, revenues impact you, right? So having a united voice calling for revenue solutions to prevent cuts and to also invest in more services, mitigate harms of the federal cuts, I think is incredibly important right now. And legislators need to hear that side of the story as well. I think, there's a lot to be said about intersectionality of all the different issue areas. And of course, like the impacts to safety net cuts and health cuts and housing cuts or lack of investments in these areas are, of course, interconnected. But I might pass that piece of it off to Masi and Laura. Thanks.
Yeah, thanks, Kayla. I think it's important to hear from all aspects of it, right? Masi, I think you all are a part of a lot of coalitions, and I think on our call today are a lot of folks that from individual organizations also constantly come together and build power together via coalition building and collaboration. So I'm curious if you can help us maybe talk about some of those opportunities you're seeing as well.
Thank you, Joyce. Yeah, I think really built into the way that CIPC does work is doing it with in coalition with one another. We know we're so much more powerful when we work together and we are aligned. And so some of our coalitions include the Health for All coalition that has been fighting for over a decade now to expand Medi-Cal to undocumented populations. And that coalition now is working together to ensure one, that those undocumented populations that we've been advocating for decades continue to have some access to Medi-Cal, as well as looking at the newly excluded HR1 populations like refugees, asylees, and making sure that there's unity amongst the immigrant community. We don't want to see anyone left behind, and that's why coalition work is so important. There's over 140 organizations in that coalition. Additionally, on the legal services front, we work with legal service organizations across the state for the One California Legal Services funding that we advocate for. That coalition, every time we send letters to the legislature, every time we meet with the California Department of Social Services, we have over 150 organizations involved and engaged there as well. On food access, we work with the Food for All Coalition, That's where we've advocated for the California Food Assistance Program, funding for adults 55 and older, and have a North Star of eventually making sure that all undocumented individuals have access to food. But that's also where this year, given the cuts to CalFresh, we're going to make sure that asylees, refugees, victims of domestic trafficking are not left behind. And then lastly, on the economic mobility side, we have our Economic Mobility for All coalition. That coalition was instrumental in advocating for the social entrepreneurs for economic development funding that was in the budget last year, and is working to make sure those micro grants, those entrepreneurial trainings, the technical assistance that comes with that program is available. And so that's how we really work. And when it comes to the revenue generation, to Kayla's point, all of these groups are going to be all in on that fight, because we know it's going to be an uphill battle to make sure that our communities get their fair share.
Thanks, Masi. Laura, same question around opportunities for collaboration and coordination in this moment from your perspective.
Yeah, well, we'll second what Masi said about the Health for All Coalition. Absolutely has been such a leader in the space around expanding access to coverage and care in California, and I think will continue playing such an important role in that space. We'll say that, absolutely full scope Medi-Cal is by far the best option for the health and well-being of patients and for the healthcare system in California. And that said, we're in a very, very difficult budget year. So there are some partners who are coming together to really think about, do we need to consider some sort of alternative coverage option for all of the folks that fall out of coverage and care? So folks who fall out because of work requirements or biannual redeterminations, and folks in immigrant communities based on the state budget cuts. What is that option? Because we know that sending folks back to the counties is not an option. The infrastructure is not there anymore. The funding isn't there anymore. We can't go back to a piecemeal approach. So I'd say it's really an opportunity for all of those partners who are so dedicated to the same long-term solution here to be really, really working together around what that solution is. And then quickly, I would just also mention that there are some statewide LGBTQ plus coalitions that are very active right now, particularly around trans healthcare, but around broader LGBTQ plus issues. One of those groups is run by Equality California and has many, many state partners, and we're working on a budget ask this year. And then Health Access also runs one of those groups as well. But I would say really, as much as possible, really thinking about how we support each other across those different populations at this point too, because we know that there are these like major targets and federal threats on specific populations. So thinking about how do we tie those issues together and really think about like making sure that we are protecting all Californians in this moment.
Thank you, Laura. And let's stay with you. I think you give us a nice segue into this last question around future risks to the state funding, potentially from further budget cuts at the federal level. So I'm curious if you can give us an insight on if you're monitoring any other potential federal budgets that will trickle down into the state as well.
Sure. Yeah. So I think one of the questions there is, will we see another budget reconciliation bill? I don't have a crystal ball and I don't have an answer about that right now. I think there's a lot of other things happening at the federal level. So it's certainly something we're monitoring, but isn't like the most imminent risk. I would say the other things we are monitoring and our immediate risks are things like changes to federal grant funding. There is new language for federal grantees in their grants policy statements that allows the federal government to terminate federal grants for convenience for basically no reason at all, with no ability to appeal those decisions. So just a few weeks ago, we saw over $2 billion of SAMHSA grants essentially cut off overnight, Luckily, that was rescinded and they were restored within about 24 hours, but is absolutely on our radar right now is, those really big cuts to federal grants, and, for all kinds of providers and community-based organizations. And then the other things that we're paying attention to, there's some attempts right now by the federal government to withhold federal funds to Democratic states and specifically withhold Medicaid funding to sanctuary states and cities. We haven't seen particular details or ways of how that will happen right now, but it is something we are closely monitoring and tracking right now too.
Thanks, Laura. Masi, what type of federal level impacts are you all monitoring in this moment?
Honestly, it's everything that Laura mentioned. And when we see these threats, there's oftentimes litigation that follows. Then we monitor the litigation, and we always think through, are there state or local opportunities to potentially lessen the impact of these funds, whether that's, again, funding for legal services that was coming down from the federal level, whether it is attacks on sanctuary cities or democratic states, always just being mindful that those attacks are very present, and that this administration is trying to find every way it can to undermine democracy, and then working with our partners that do litigation to keep the state legislature up to date on what those impacts will look like in California.
Thank you, Masi. Kayla, I want your voice in this too. Any comments on any federal things you all are monitoring?
I know there are things that my colleagues are monitoring, particularly in like the housing and homelessness space, threats to funding there. I don't have a great handle right now. We're still kind of trying to dig out from the HR1 impacts, but of course there are a lot of, we're keeping our eye on threats in the areas of appropriations and the areas of just, funding freezes to states that are targeted, as Masi and Laura mentioned. So yeah, there's not much specifically that I can call out right now.
Yeah, thanks, Kayla. And I do want to call attention to, there's a link in the chat with additional analysis on the budget. That's a great resource from the California Budget and Policy Center, which kind of lays it all out that we didn't get a chance to go to, but you'll see in the chat, and we'll add that in our resources after the call as well. So thank you all. I know this vibe is not it this year, but really want to call the attention to what the thread has been around collaboration and coordination, really protecting each other in this moment. We're now going to turn to audience questions. If you haven't already, please enter any questions you may have in the Q&A box at the bottom of your screen. We'll try to get to as many as we can today. I know we already have some in the queue. And yeah, let's shift over to our audience Q&A. So for one of the questions we received, this is for, let's see, it was a little bit, give me one second here. I think it was for Kayla, a question around saying a little bit more on Prop 98 funding and what it could potentially mean for more or less for community colleges, given that Prop 98 is a big lion's share of the state budget.
Yeah, it's a good question. And I am not my office's Prop 98 expert, but because community colleges are included in the Prop 98 guarantee, in the increased revenues that increases the minimum guarantee would also increase funding for community colleges. But there are a lot of complexities with Prop 98 in that as revenue estimates and projections change, the guarantee also changes. So it's going to be a couple years down the road when the final numbers are decided. And the one thing that I will also note that the governor included a proposal to basically withhold about $5 billion of the Prop 98 guarantee because of that revenue uncertainty. So it would basically create this kind of settle up obligation that would be paid later if the revenues materialize. So I won't say much more than that because it makes people's heads spin, but thanks for that question.
Yeah, no, and another plug for the California Budget and Policy Center's website and all of these resources that you can get more details on. And another question from our audience Q&A section, a question for Laura. Could you share a bit more on community health centers' funding streams given the budget impact? And if there are any conversations about changing how they're funded to better align California's values to serve immigrant and other vulnerable communities in this moment?
Thank you. I mean, it's a little bit of a tricky question because some health centers, not all, but federally qualified health centers, rural health clinics, Indian health clinics are all federally funded. And that really provides an important core piece of their funding mechanism because there's both a federal grant component to it, but it also provides the pathway for their reimbursement rate, which is called a prospective payment system or PPS, that allows them to really serve anyone regardless of their insurance coverage or ability to pay. But that said, health centers also do really rely on, state-only funded programs as well, especially as we continue to see these federal attacks on specific populations that are really core to who we serve as health centers. So I would say health centers are thinking through what are our options in this moment. Do they need to find ways to segregate their federal funding from programs and services for particular targeted populations, and set up things like other lines of business or create entirely separate entities or do this through partnerships? It's really a question right now that a lot of health centers are grappling with, based on these threats, is like, what are our options? But those options will require the state to step up and make sure there actually is funding available there, to be able to continue serving those Californians.
Yeah, thank you. Thank you, Laura. I'm curious, thinking about our audience, which includes a lot of nonprofit leaders in our communities. What strategies should nonprofit leaders consider as the budget landscape continues to get more challenging? Masi, maybe we'll kick it off to you first.
Yeah, thank you for that question. I think one thing that we've already touched upon is the coalition work. So if your organization isn't a part of a coalition or coalitions that are doing this work, those spaces are really great to stay informed on the changes that are happening at the local, the county, the state level, and then be able to advocate in a way that you have more power. I think second, it really is about diversifying your funding in as many ways as possible, whether again it's local, state, philanthropic dollars. I know many organizations were relying on federal funds, and over the last year they're looking at these different means, and that really pairs well with the coalition work because there are coalitions at the local and statewide level advocating for those funds. And then I think lastly, I would say, as we're facing these attacks as individuals and organizations, investing in the wellness and safety of your staff in this time is key to continue that continuity within our organizations and the work that we do. I know that many of the partners that we work in the immigrant rights space, if they were to lose key staff, it would impact the whole movement, and we want to make sure that we're taking care of one another in this time.
Thank you, Masi, for underlining and highlighting that point too. As we get towards the end of our time together, Kayla, perhaps this question is for you around what's next on the budget timeline and what opportunities are there for public and community organizations and other advocates to engage in the 2026 budget process?
Sure. So we're kind of in one of the more transparent phases of the budget because now is the time between now and May that the legislature will be holding a bunch of hearings. The budget committees and the issues focused subcommittees will be holding public hearings on the budget, the governor's plans, and there'll be informational hearings on other issues. I think, we've seen some legislators already express some frustration that the governor's budget proposal doesn't include much in the way of addressing future challenges, and basically says, we're going to wait until the May revision when we have a better idea of what the budget situation might look like, what revenues are looking like to make proposals. And what that does, if those kinds of proposals are delayed until May, then the legislature and the public has very little time to sort through those and get public opinion. But I'd say between now and May, folks can really pay attention to what those hearings are. When the subcommittees are holding hearings on issues that you care about, you can show up, you can make your voice heard for the investments that you care about, and just other timeline pieces. We'll see the governor's revised budget in May, by May 14th. And then there'll be this big scramble between then and June 15th when the legislature has to pass a final budget. In terms of ways to get involved, I would love to kick that over to Laura and Masi, who probably have some more helpful comments on getting involved and making your voices heard.
Yeah, why don't we have that be your last kind of 30 seconds here, Masi, if you can give us a sense on how folks can get involved in the budget process.
I would say one of the ways in April to get involved is joining the CIPC conference that's happening in Sacramento on April 14th. We're expecting 1,200 people there. We're going to really be talking about what we've heard, what we've seen thus far, and going into May when we're going to see the May revision. So that's one way to kind of get plugged in, especially on issues impacting immigrant communities and communities of color.
Thank you. Laura, any last comments here?
Yeah, I think just really getting engaged with those coalitions again, who are already super active in this space, who are setting up, advocacy days that folks from across the state can participate in, and are really having in-depth conversations right now is probably the quickest and easiest way to really engage with folks who are really bringing patient and community advocates into this work and centering them.
Thanks, Laura. Look for your people, right? Well, thank you, Kayla, Masi, and Laura for your insights and the helpful information. I know my head is spinning on all these details, and I've heard a version of your presentations already. So just a reminder to folks in our audience, you will be receiving this recording and information after, but just deep appreciation to our panelists today for this rich conversation, and our appreciations for each one of you that joined us today, and everything you do on behalf of Californians and our communities. Thank you all for joining us today. There's a lot to digest, and the California Endowment remains committed to working alongside other partners, community organizations, advocates, and systems leaders to advance health equity across the state. Again, as a reminder, the recording of this webinar, related materials, including slides and bios, will be shared with all registrants in the next day or two. Lastly, we want your feedback. Please take a minute to fill out the survey. I know there were so many really great questions in the Q&A that I apologize we couldn't get to, but let us know what else you want an extended webinar about. The link is in the chat to the survey, as well as you can scan the QR code on your screen. Thank you for your thoughts on today's program, and we want to hear about what topics you'd like for us to cover in the future. Thank you again, and I hope to see you at the next Policy Perspectives webinar. This concludes our program. Have a great day.